Hello, my name is Helen McAvoy and I'm here to share with you the experience of the Policy Dialogue in Ireland. Our Policy Dialogue took place in Dublin in June 2018 and it focused on how to reduce inequalities in tobacco use. And why did we choose this topic? Tobacco use kills 1 in 5 people, and people living in poverty and disadvantage in Ireland and across Europe experience the most tobacco-related harms. So progress on chronic disease prevention depends heavily on the success of tobacco control within member states and across European level. Many of you will, I hope, know Ireland as a tobacco control leader in Europe. As the first member state to introduce laws restricting smoking in the workplace and public places in 2005, we were also among the first to introduce standardised packaging of tobacco. We are ambitious, and the current strategy is to reduce smoking prevalence to less than 5% by 2025. Progress has been good, but our new analysis showed that this has been uneven, with smaller reductions in smoking prevalence among disadvantaged groups. This policy dialogue occurred at the midpoint of implementation of Ireland's Tobacco-Free Ireland strategy. A Tobacco-Free Ireland conference held in May 2018 and the State of Tobacco Control in Ireland report created important new insights into the issue of inequalities in smoking. And these developments created a springboard for a policy dialogue to examine the issue in detail. The objectives of our policy dialogue were to explore which elements of our current strategy target inequalities in tobacco use and to reflect on the effectiveness of these measures. We also wanted to think about which policy and programme actions should be sustained and developed, what new actions should be considered to address inequalities in tobacco use in the future. And how did we plan and deliver this policy dialogue? Firstly, we approached the policy leads in the Department of Health in late 2017 to seek their approval, and then we worked with our Work Package 4 task leaders and partners to refine the policy dialogue objectives and process. A key success factor was the development of our briefing paper, which set out the issue and the key questions to be addressed. And who contributed to our policy dialogue? We had an external moderator from EuroHealthNet and high-level representation from the Tobacco and Alcohol Control Unit in the Department of Health, the Health Service Executive, which develops services linked to Tobacco-Free Ireland, like stop smoking services, campaigns, training and resources, and environmental health law, the Irish Cancer Society, and the Department of Public Expenditure and Reform. And what did our policy dialogue conclude? I've listed here some of our key conclusions. We recognise that approaches to address inequalities in tobacco use must be effective in targeting prevention as well as stop smoking services. That while tobacco pricing is central to addressing inequalities, it's not enough on its own. That tobacco and social disadvantage are a cross-government agenda, an issue for poverty, for social inclusion, and for social development. That challenging attitudes and norms is important, but further evidence is needed in terms of how to be successful. That partnerships are critical to success in health inequalities, programmes and policies, and that monitoring and accountability are also critical. We reflected on advocacy in the area and concluded that some of the most vulnerable to tobacco-related harms may in fact be underrepresented. On the issue of e-cigarettes, we recognise that the importance of the development of evidence-based policy as critical to addressing social disadvantage in tobacco-related harms. So what actions were proposed? Our key actions were to better build tobacco into government consideration for equality budgeting, to build health inequality dimensions into the development of stop smoking guidelines developed by the HSE based on best evidence nationally and internationally, to enhance efforts to target investment in tobacco control, including resources for equity-focused stop smoking services and progressive tobacco taxation, and to move forward on greater engagement with disadvantaged groups, in particular communities with high levels of mental ill health. If you would like to know more about our tobacco control policy dialogue, please go to the CRODIS Plus website. Thank you and enjoy the rest of the conference.